Hello, everybody. Welcome to episode 5 of the PwC Tech Talks, which was originally scheduled for 5:30 in the morning, my time here in Austin, Texas, which is why it never started. So my apologies.
Where's the commitment, Jeremy? Where's the commitment? Wake up at 5:30 for people.
I know. I should have been up. I should have been up at the time, ready to go. The actual fact is I set this event while I was in Portugal, so the time zones got completely messed up. So I take full responsibility. Apologies for anyone if you missed the talk because I set it for the wrong time. But we are running now, thankfully, and we are fully in action. We have Neesa here, we have Alex here, and with these two here, we're absolutely ready to go. Nothing could possibly go wrong. So I have full confidence. It is wonderful to have you all here today, and thank you if you have been getting my messages about this. Hopefully we're seeing you here. Let us know if you have successfully joined us by telling us where in the world you're from today. And that would be great to hear, so we can understand who's joining us and what city they're dialing in from or listening from. We always like to see and find out all these interesting places that people join us from globally. So we're super excited to hear that. Meanwhile, while that goes along, I will let Alex introduce herself. I'll introduce myself very briefly. You've heard from both of us before, but for those who are new, you'll be able to understand where we're coming from. And then Neesa will pass to you for an introduction. And then we'll talk about this amazing report that we worked on together and a little bit of the summary of that. So over to you first, Alex.
Sure. Hi, everyone. Excited to be talking about this for me, healthcare is one of the most exciting subjects when it comes to XR, because this is where we see the tangible value. So for those of you who don't know me, I run the immersive technologies team here at PwC UK, get to work with lots of different exciting kind of industries, but healthcare is one that I've been turning my attention to recently for all the exciting innovation that's happening in adoption of VR, AR, virtual world technologies. So that's me. What about you, Jeremy? Do you want to do a quick intro?
Absolutely. So I am Alex's equivalent in the United States and have been involved in the XR industry for a number of years now. Very excited about its applications in industry, and particularly healthcare, which we know is one of the most prominent areas, or one of the areas with the biggest potential for XR technology. Also the author of a book called Reality Check, which I wrote to try and help convince people about the value of VR and AR outside of gaming. And yeah, been very excited to implement these projects all over the world. Over to you, Neesa, our most important person on this panel.
No pressure. Thanks, guys. So hi, everyone. I'm Neesa Mangalaparathy. So I formerly worked at NHS England for 2 years, and that was my kind of, well, I've had some touch bases in the past, but that was my main touch base into XR, extended reality, understanding what it does, how it works in healthcare, and all of the things that we'll probably touch on later in this call as well. But now I work for UCL Partners, so as of week 2, so still fairly new, but it's essentially a health innovation partnership. So working with our healthcare providers, researchers, industry to tackle health challenges that are faced by about 5 million people across North London in the UK.
Just a small task then.
Just a small task.
And we first met, Neesa, when you were in the NHS, and we ended up working on this report together, which was super exciting. The team, I remember when that came through, we were over the moon about writing it. Originally, we were thinking this would be maybe a 50-pager type report, something fairly concise, and we'll talk a little bit about a few points in healthcare. But then we ended up, in our research, coming across so many things that it expanded to a 200-page report, which some stakeholders were not too happy about, but I think secretly between us all, we were thinking to ourselves, yes, XR and healthcare, this is where it's all at. We ended up being very proud of the report, and we're very happy to see it go public. So we'll provide the link to the NHS report at the end of this, and we'll also provide a link to a few pieces of thought leadership, some from PwC, some from other companies as well. So you'll be able to access a lot of list of resources relating to XR and healthcare after this. But yeah, to perhaps, Neesa, do you want to talk us through the summary of why we did this report, with the methodology behind it, and then we can dig into the benefits that we found XR in healthcare, as well as some of the barriers that we experienced in chatting to people across the healthcare sector.
Yeah, sure, no problem. So I guess one of the main reasons why the NHS became interested in XR was primarily because of the pandemic. As the pandemic sort of emerged, what we saw was that providers started turning to different types of technologies to really help respond to the pandemic, still provide healthcare services to the public. And interestingly, one of the technologies that was used was extended reality. So that was not only to provide patients with care, but also to support staff with their well-being, or for education and training, or for connecting them across, different parts of the country as well. So what we really wanted to do was explore that. And so we wanted to review the use of XR across the country, what opportunities and challenges that then brought to the healthcare, to everything that's set up around our healthcare system as well, and identify really those strategic possibilities for healthcare. So how could we, potentially use it to provide the best services for our people in a safe and cost-effective way? So that's really where it came from.
Brilliant. Yeah, thanks for that, Neesa. And I can see everybody joining us from all over the world here, and this is amazing. So today we've got Dubai, we've got Rome, we got Baja California, Mexico, Tenerife, Havana, and even Andrew Bigwood from the J11 exit on the M25. We should turn the Tech Talks into a radio show you can listen to in your car on the way to work or from work. But yeah, no, that was excellent. Thank you, Neesa. What we found from chatting, because we had a lot of discussions, we ended up having a lot of focus groups, we had a lot of calls with different stakeholders, and not only the obvious ones that you might think of, the doctors, the frontline workers, but we also went behind the scenes to talk to the XR vendors that provided services and products to the industry. We ended up, I think, even talking to a group of school children at some point to get their perspective on what they were thinking about, because there were some applications. If I remember correctly, there was one particular one around introducing patients to a procedure that's about to happen to them, and trying to reduce the anxiety by preparing them for that event, or how they're going to go through that experience, like an MRI, for example. And we found that, I remember that particular as being one area of interest that we were mentioning to the school children at the time. But yeah, so that was some stuff we were going on there. We're talking to different stakeholders. Now, what we found is there were a number of different benefits from all of these different areas. And perhaps I'll bring some up on screen here, and then we can talk a little bit through them. There we go. So this was one particular area, and we'll give you a summary shortly about the key areas or use cases that we found from the analysis we conducted. But I thought the benefits might be interesting to speak about, because there were many of them, and they were a little bit different per use case. But this kind of summarizes, and this is a screenshot from the report, by the way, so you'll be able to access this. You don't have to take notes or anything. We can see here a lot of different outcomes, very positive ones. Are there any, Neesa and Alex, that stand out to you as being particularly important?
I mean, for me in healthcare, the biggest one is positive patient outcomes. And we've seen, lots of the sites across the country use XR in different ways to achieve that. So I know that up in the north, they're using XR to support people with Parkinson's, and really seeing what providing rehabilitation through XR can do to a patient. The qualitative outputs are amazing. Similarly, there are other ones around community care, so providing different types of therapies for people with learning disabilities and so on. So VR therapies have done a fantastic job there as well. So lots of examples across the country, really.
And yeah. Alex, you and I are not in healthcare specifically. So what stands out to you?
Well, do you know what's really interesting? I feel, and maybe this is where my affinity for the XR healthcare use cases comes from is one of my very early forays into the VR world was with hospices. So Lauros Hospice in the Midlands in Leicester pioneered this idea of, taking things that were not physically possible and bringing them to patients nearing end of life. So that no physical limitations piece here on the benefits was something that we saw, regularly, right? Was people who were not physically able to leave the hospice were now all of a sudden able to get some respite by able to visiting old parks that they, grew up kind of walking around, or going on a bucket list trip to kind of like somewhere where they never got a chance to go to during their lives. And, there's obviously the emotional side of that, which comes back to positive patient outcomes, but there's also this ability that actually specifically virtual reality allows you to do the impossible. And that was something that really stood out to me and has always stayed with me as probably one of the best uses of this technology.
Absolutely. I mean, it's the ultimate example of tech for good, right? Truly amazing. But I'm interested in what everyone in the audience thinks. So we're gonna reveal to you the 4 key areas that we found from doing this analysis were the most mature application areas. So we found 4 of them, and we're going to list them in order of maturity from most mature to least mature. Now, I want you all to try and take a guess about some of the ones on those lists, and you can just write it down. We'll be able to see it here in the StreamYard platform. And tell us where in numbered 1 to 4 you think it's going to be listed. So number 1, most mature use case. Number 4, least mature. But still, talking about the top 4.
I've seen some healthcare specific experts in the audience already, so I'm sure there'll be some people here that know the answer. But
exactly.
Yeah,
we'll give you a little bit of a hint. The stuff that Alex was talking about is not in the top 4. So despite how important that is and how really exciting that application area is of being able to use virtual reality for good, for palliative care, for end-of-life care, to try and help individuals enter another reality and allow them to escape the drudgery of their current conditions in many cases. Virtual reality, really powerful, fantastic use case, but not part of the top 4 that we saw from our analysis. So we have Lucy has guessed improvement in learning. And I'll tell you, Lucy, you are very warm. In fact, if I were to translate learning to training, then you're right. That would be on the list for sure. And we'll reveal exactly where on the list in a second.
We've got Edward here saying pain management, probably, one of the very specific to healthcare applications of this technology.
And that is on the list as well. That is on the list. Yeah. So we've got 2 out of the 4 on the list so far. I just saw Gert-Jan. He's saying physical therapy. And absolutely right. And by the way, we did not plan this, by the way. We do not have plants in the audience giving us these answers. But yes, you're absolutely right, Gert-Jan. Rehabilitation and physiotherapy is on the list as well. There is one last one remaining, and it is, well, I'm kind of going to give it away here, but it's not related to the physical. So what do you think it is? I know Neesa knows the answer, so I'm not going to.
Staying quiet.
Yeah. Anastasia's got one here. Psychotherapy is the treatment of phobias. That I would say is a subsection of this final element for sure. Yeah, we've got a few more guesses here, but I'll tell you what. Let's do the big reveal now. Let's see if I can get this right. Let's change to that window here. And the top 4 in order of most mature to least mature.
Drum roll.
For our analysis. There we go. Training and education comes up top in healthcare. And I mean, that kind of is to be expected, isn't it, Alex? We've been seeing training as a use case for XR all over the place and for many years now.
Absolutely. And I think it's also interesting. There's a crossover between probably one of the areas that's the most studied in terms of, actual quantitative data against that section, right? So, I mean, to be fair, I'm not a healthcare expert, so Neesa, correct me if I'm wrong, but I imagine that is the one that's probably the easiest to quantify in terms of the impact.
Potentially. I don't think I'm a health expert either.
Too modest, Neesa. I would so the interesting. A lot of people are saying in the audience here. We've got Sarah talking about well-being, Stephen on rehabilitation, Denise. Yep, exactly what we were saying before. Phobia is a subset of anxiety, which itself is a subset of mental health and well-being. So a lot of interesting areas here. But Neesa, talking about the mental health and well-being one, which was the last one to be identified by our audience members, how important is that now in healthcare? And what do you think is interesting about that particular use case?
So mental health is a big priority across NHS England, and the wider NHS, or the provider settings as well. And what we have seen is that there has been an increase in the number of suppliers that have been approaching the NHS with the number of solutions around mental health, saying, we know this is a problem. This is potentially what could be used to help address these needs, address these problems that are happening. So some of the interesting ones that come to mind are around things like psychosis, things around anxiety and phobias. Some of these have been mentioned in the chat as well that I can see. And what is also potentially challenging is the evidence that's linked to the mental health applications of XR. So there are some really good studies out there, but also some really questionable ones out there. And I think for something where you're applying a technology as a digital health therapy, actually that's when we start to hit some of those barriers that we see in healthcare.
Well, this is a great segue actually to another area of our discussion, which is around the limitations of XR in healthcare currently, because we did analyze that as well. And we did ask all of these different stakeholders across the value chain in healthcare for their views as to what is preventing this technology from becoming more mainstream in healthcare. And we talked about it in a very granular way. We asked them for barriers specifically in adoption of training and education as a use case. We asked for the barriers with regard to mental health and well-being. But let me bring up the responses we got from barriers to training and education. We saw a lot of these across the other areas as well. Each one was a little bit different. But in order to give a sort of idea or a sense of what challenges and what barriers there were, we've got a number of these up on screen now. And as you might expect, I mean, budget pressures are super high. So cost ended up being the largest barrier to adoption. Neesa, did you see cost pressures as well from where you were sitting?
Absolutely, and it's one of the first questions we get asked by healthcare providers, but also from suppliers. Where can we access funding to actually test some of our stuff?
Yeah, and Alex, are there any ones you want to pick on here that you think are particularly interesting? And to our audience as well, if you're seeing something on this list that you think is relevant and you want to add a comment to that, let us know. Equivalently, if you find something that is not on that list, also let us know, and we can talk about that too and see if we've seen that elsewhere.
Yeah, definitely. And admittedly, my eyesight is awful, so excuse me as I get close to the graph. But, you know, I think the point around resistance from patients is very interesting. And it's interesting, right? I'm not working on the kind of the front line, right, and seeing that day-to-day kind of resistance. But I would say that I can see that just in general, whatever industry you're in, there can be a little bit of a kind of a skepticism, right, around trying new technologies. I think people often have some kind of preconceptions around what they're for. I remember, again, like going back to that hospice case study when we first discussed kind of VR, very much people's first impression was, well, isn't that just for gaming kind of thing? They couldn't really see beyond like what the kind of potential of the tech was. So I can imagine. But then on the flip side, I imagine that actually what's also really exciting and that kind of goes against that stereotype is what I loved about the kind of healthcare applications is that people that you wouldn't traditionally see buying these devices, consumers actually got really excited about this opportunity of doing something in a new and different way, and actually were looking for some new way to engage in something like rehabilitation or that escapism, mental health kind of experiences. So yeah, that's the one that jumps out to me. But what about you, Jeremy?
Well, I think it's fair to say that some of these are relevant cross industry. So this idea of resistance from patients, you can apply that more widely as resistance from users. And we have seen resistance from users across every industry, and that's for many reasons. Some of which are noted here, but others, we've talked about challenges of XR before. The weight of the headset, some people view it as very invasive, it's a different type of digital interface, and so on. But the other areas that I think are really interesting and perhaps are not unexpected, but are worth raising because of how basic it actually is. The fact that poor Wi-Fi network is one of the top issues. It's definitely, you can see here, it's top 4. Slightly concerning when you're trying to introduce an emerging technology into an organization. And I think it's fair to say that is not a healthcare specific problem either. But all of these supporting technologies need to be able to work in order for us to benefit from XR in the greatest way.
Yeah, totally agree. I'm just going to put us back into our speak formation here because I want to ask Neesa just to kind of move on slightly. I'm curious, someone here, Chris, put, skepticism, like is skepticism like one of the kind of big barriers? And we were kind of talking a little bit about that. How do you get over that kind of that initial hurdle of people's preconceptions? But I'm curious from your point of view, what is it that you would advise, whether you are a healthcare practitioner in the audience or whether you're actually a startup, working on this as a technologist and trying to get into healthcare? What is your kind of, I guess, advice for either end of the spectrum in terms of approaching this? Is it about keeping an open mind? Is it about having an outcome in mind? What's your kind of thoughts on that?
I think there are a lot of myths to bust here because I think there is that. You talked about sort of VR, AR being a gaming thing. There's lots of different things that people think about AR, VR, and other parts of the tech that belong in that XR spectrum as well. But actually, when it comes to it, one of its biggest selling factors is its immersive experience. And in healthcare specifically, what we found is that, yes, there is that natural resistance to something that's new. But it's so immersive, it's so experiential that actually you put a headset on and people can immediately see how effective it can or can't be. And I think the thing that's been really important is not just having the decision makers sort of try the equipment, try the products, but also making sure that the content is really good, because in the same way that you can turn someone on, you can quickly turn people off of something as well. So does it meet their exact problem needs? They use, the things they're actually looking to address. Is the content good? What are the other things that they are looking for? And does, AR or VR address those issues?
Absolutely. And I think another area which is worth mentioning is a few people are raising different challenges here. We have one user who's posting from LinkedIn saying a major barrier to XR adoption in public health is the challenge of integrating third-party platforms, especially with learning management systems, data reporting, analytics, and so on. And I think that's a fair comment as well, because until this technology becomes more deeply embedded in organizations, whether it's healthcare or otherwise, there will always be a ceiling to the amount of value that we can derive from the technology. And that's not to say it's not possible, but it's certainly harder to integrate it into systems with all the IT checks that need to be done, with all the different stakeholder teams that have to agree, with the connections that have to be built. But it is absolutely a very valid point as well. Any others from the audience you're seeing, Alex, that are interesting?
So this one I thought was good to point out. I love this idea of, a lot of talk, but not actually getting hands-on with it. So it's a chicken and egg problem. Companies should enable the time to experiment. And I agree with that. I think also, and I mean, look, we're in precarious economic times. There is a lot of pressure to prove the value of something before you go ahead and do it, which is it is a bit chicken and egg, because how can you prove the value without actually doing it? But I do think you're right. I think if you're in a position to be able to allow for experimentation and kind of carve out time, to look at what's coming down the road, because that's the thing, right? This is all kind of fringe technology right now, but actually in the next 12, 18, 24 months, who knows, right? Because all it takes is one major kind of leap forward in the hardware, or the onboarding experience, or connectivity issues, something as simple as that, and all of a sudden you'll get this new raft of excitement. And if you've not already carved out that time to kind of keep an eye on what's happening and where the value lies, then you're not maybe necessarily ready to jump on it.
Yeah, and let's be honest, Neesa, we saw that the applications were already being implemented in healthcare. So despite anyone's view on the early stage nature of the technology compared to what we have out there right now, the fact was that clinicians and first line individuals in the healthcare space were already implementing this technology, sometimes even without the strategic direction of their leadership. So we saw that a lot across many different organizations in the healthcare space. It was a grassroots operation. We had doctors picking up headsets, using it, testing it, because they could see the value there. The studies were out there. There was data showing at least some aspects of potential for the technology, and anecdotally, they were getting results. Is that fair to say?
Absolutely. I think it reflected really the risk appetite and the variability of the risk appetite across healthcare system, whether it's in the UK or across the world. Really, everyone's got a different level in whether they're willing to embrace something, try it and test it and see if it works, versus some of those who are maybe a little bit more cautious about using it in that space, particularly where it links to patients and safeguarding as well.
Yeah.
Which is and I think that's probably one thing that a couple of people have been highlighting is it's all about as well the kind of security and data protection and patient safeguarding, essentially, which I imagine is always the absolute priority when doing anything with technology in the healthcare space. So that's a really interesting point. I'm aware that we've only got a few minutes. If there's any questions that the audience has for Neesa, please put them in the chat now, and we'll try and get around to one or two more before we wrap up. But Neesa, I'm curious, what are you excited about? Right, like, because the report that was even a little while ago now, right? So what are you excited about? What are you seeing? What's something that maybe we haven't touched on?
I think one of the things that have been most exciting for me is the partnerships and collaborations that are formed. So there's been this network that's been pulled together, particularly across the UK, hopefully across other parts of the country as well, that spans not just our country, but also how we work internationally as well. So, setting the infrastructure up so that as soon as I say this kicks off, I know it's been kicking off for a while, a few decades even potentially, but once that gets going, actually what we've done is we've been able to influence the design of that. So making sure things are safely adopted, making sure that the things that we do have impact. And so seeing how that comes to fruition, we're already seeing some of the examples across the country of where, we've really seen it working. You talked about mental health before. There's a couple of companies now going through, evaluation formally to see if they can be prescribed as a digital therapy. So there is change that's starting to come, and it's seeing that follow through that I think the impact on healthcare could be really promising there.
And I know we've got only 2 minutes left, but Nilusha was asking for some detailed, or let's say specific concrete examples on how to use AR, VR for pain management. And what I'll say, Nilusha, is if you go to the report, which is available on the NHS portal, starting at page 114, there is a deep dive application area into pain management. And there we've got examples from across different territories. So we have examples from the Americas, we have examples from Asia, Australia, we have examples across Europe. So there are examples from different regions on not only pain management actually, but also different areas. And we talk specifically about individual companies and what they've done with links to further information. So definitely check it out. It's well worth it. I'm going to put a link in straight after this, so you'll be able to see on this post on LinkedIn a link to where you can download the report on the portal. But that's it for time, I'm afraid. We really appreciate everyone's engagement on this. And again, apologies if you joined many hours ago while I was still sleeping away here in Texas, and appreciate your patience with it. And thank you so much for being such an engaging audience. As always, we will make sure to get you the next Tech Talk episode, which will run in 2 weeks' time, as soon as we can. Neesa, thank you so much for being our guest and being such a willing participant and a knowledgeable one as well. We really appreciate all the work you do, and look forward to staying in touch.
Thank you. Thanks, everyone.
Thanks, everyone. Bye for now.